Hello, welcome to AMCI Saturday Study Session, or SSS. I'm Mrs. J, Curriculum Director here at AMCI, and I am delighted to present AMCI Lead Instructor Ms. Tamika, along with her guest. Without further ado, let's get started. Take it away, Ms. Tamika.
Good morning. Good morning. How are my coders? Hey, Geetha. Hey, Giovanna. Hey, Heather. Lawanda. I hope you fabulous coders are doing well. Well, hey, we are going to do some fun stuff this morning. You know how we do it. Hey, Octava. I hope you guys are ready to do some coding. I know you got your favorite pen or pens. I told y'all I don't let anybody get near my favorite pens. Get that CPT manual. I'm sure it's worn that's just where it should be right about now. You got tabs in there. You got all kinds of writing and notes in there. You are ready. Yes, you are. All right. And guess what? I've got someone joining me today because my right hand, Miss Andrea, look here. She had some important stuff to do today, but she'll be here next week. But I've got guess who? Come on, lady. I'm not gonna spill the beans. Come on.
Hello, coders. How are you? Oh my gosh, it's so good to see your familiar names. And it's especially good to see the familiar overachievers who I would constantly be writing 98s, 99s. I'm like, and 100s. Are you kidding me? How are you doing, coders? I'm so glad to be here today. Thank you for Miss Tamika for having me. And the cardiovascular system, this is awesome. Coders, if you can rock this class, you can rock your exam for sure. Okay, well, I will talk to you in the chat. All right, happy coding.
Thank you so much, Miss Bennett. So, hey, you guys know Miss Bennett knows what we're going to do and how we do it. All right. So, I knew she didn't need any introduction. You guys already knew that beautiful voice. All right. So, we're going to get rolling. Hey, Lawanda. Hey, Octava. Let's do it. Hey, Shabakun. All right. Everybody's got their manual. You got your beverage of choice. You guys get ready to blow us away, as I know you will do. We've done the introductions. You know who we are. All right. I'm going to read that copyright. We have no announcements other than to let you guys know you guys are fabulous. And I know you are ready for this morning. You already know the steps for solving that time scenario. Remember, you're going to remember the who, what, when, where, and how. Okay. Keep those things in mind as you begin to work that scenario and then zero in on those keyword concepts. All right. Remember your facts to remember, particularly with your cardiovascular, any of the chapters, those facts to remember, naturally, I like to say it's like your roadmap, like your GPS, okay? It keeps you centered and focuses you on where you need to go and what you need to do with those codes. And then we're going to jump into those time scenarios because that's what you're here for. Hey, we got to make a good investment of your precious Saturday morning time. All right, so our copyright, CPT copyright 2020, American Medical Association, all rights are reserved. CPC is a registered trademark of the AAPC. AAPC content found within this presentation is copyright of AAPC. Keyword concept, FTR, Chun, AMCI Fab 7, Flip, Tap are trademarks of AMCI. All right, behind the curtains, we got this character over here. They are ready. They're running, and I know you guys are off and running and ready to do it. All right, so let's do a little coding, shall we? All right, so the next voice you'll hear will be that of Miss Bennett. You know how we do it, and after she completes the reading, you guys will have 2.5 minutes to solve. All right, lady, it's all yours.
Okie dokie. A 33254, B 33255, C 33256, and D 33259. May's procedure is performed on a patient with atrial fibrillation. The physician isolates and ablates the electric paths of the pulmonary veins in the left atrium, the right atrium, and the atrioventricular annulus while on cardiopulmonary bypass. What CPT code is reported? Coders, your 2.5 minutes begin now. Okay, that's time. I see lots of good answers, Miss Tamika.
Thank you so much, Miss Bennett. Hey, I forgot I didn't have to have my timer going. We tease Miss Bennett. She keeps us all on track, guys. She is excellent with time. And trust me, if you guys were with me before it's time for class, you'd understand why I'm a chatter, as if you guys didn't know, right? All right, like Miss Bennett said, a lot of great answers. If you didn't quite get there, that's okay. We're going to give you that little nudge and tell you why, all right? The answer is indeed C, and you guys blew it out of the park, out of the water, all that good stuff, all right? So let's go ahead and solve it, okay? You guys already know, so we're just going to breeze through. We have this maze procedure, and it was performed because the patient had atrial fibrillation. The physician is going to isolate and ablate the electrical paths of the pulmonary veins in the left atrium, the right atrium, and the atrioventricular annulus. Okay, and while doing all of this, this patient is on cardiopulmonary bypass. Okay, so let's zero in on maze procedure. Like I said, you have these key words, but there's certain words that will help you to pivot to the right code. All right. So all of these paint the picture, but certain words will help you to pivot and zero in on what you need. Okay. So we have this ablation, the left and right atrium. So while they're on cardiopulmonary bypass? Well, the first thing first, right here, this 33259, even if it said some things that we need right now, we know it doesn't matter because what do we know about this add-on code? It cannot be first. All right. I love it when they do that because we can quickly get rid of an incorrect answer. And so, boom, it is out of here. All right. So we're going to continue on. We have code 33254. Well, they mentioned a maze, but they say modified maze procedure. And this is simply a maze procedure. Again, we've got to be forensic. Okay. So not quite there. This is modified maze, not a maze procedure. And that's specifically what we're looking for. We continue on and we see code 33255. It is operative tissue ablation, reconstruction of atria, extensive. But boy, oh boy, look at there, right there. Even before we read all of that stuff, maze procedure. Okay, so this common language, like I always tell you guys, and I know you know it at this stage in the ball game, but I like to repeat it. Okay, repetition. Hey, it's never hurt anybody, right? Everything before this semicolon is the common code language, and this is good stuff. And it's talking about the maze procedure. Okay, but the issue with 33255 is that this is without cardiopulmonary bypass. Okay, and so that, yeah, you know how I like to just make that light up for you, make it jump off the page. That's why that would not be coded, the 33255. That's without cardiopulmonary bypass, but code 33256, because this common language is good, along with this, that's exactly what this scenario describes. Okay, and so we don't have to worry about any of our do not codes, all right, because we're coding for just one thing and none of that stuff is listed. So indeed, C is the correct answer. All right, you guys blew it out of the water. All right, we're going to keep it moving because y'all are ready. I think they're ready. They're ready, Miss Bennett. It is all yours.
A 36561, B 36563, C 36560, D 36558. A physician places a centrally inserted tunneled central venous access device with a subcutaneous pump in a 7-year-old patient. Your 2.5 minutes begin now. Good luck. Okay, that is time.
Thank you so much, Miss Bennett. And yes, she is the timekeeper, guys. Yes, and she's correct. And yet we still go over the time sometimes, even when she's keeping me on track. That's all right, Miss Susan. I know you are waking up. And hey, some of you needed a little nudge. And once you got it, I'm seeing some terrific answers coming in that chat, and we love it. If you haven't gotten your answer in there, or you need just a second, go ahead and pop it in there, because we're going to keep on moving. All right. So this physician is placing what? A centrally inserted, tunneled central venous access device with subcutaneous pump. And this patient is 7 years old. So let's take a look. Okay. So just as an overview, if you guys would like to grab a screenshot of this, you may. Okay. So 1 second there. There we go. There we go. All right. So I'm sure you're going, okay, what am I taking a screenshot of? All right. So if you want to take a screenshot of this, you can, just to give you a general idea, just an overview when you're talking about catheters. Okay. If it's non-tunneled, they're strictly going in right here into a large vein near the neck, the chest, or the groin. Okay. And this is going to be used, oftentimes you'll hear it called a central line. They're going to administer medications, fluids, things that the patient is unable to take by mouth. All right. This is non-tunneled. But if you see a tunneled catheter, they've gone under the skin here. All right. And this is more for long-term use. All right. And it'll be tunneled under the skin. And again, they could administer medications in various things. Okay. So that one is long-term use under the skin. If you see a subcutaneous port, the difference being it's going into a vein, it's under the skin, but they're going to leave a little round chamber. Okay. So you don't have all these little things dangling along with this catheter. They're going to make it into a port. So you've got the line, but you've got a little port or a little chamber. Again, you'll see this if they're delivering chemo or blood transfusions, antibiotics, IV fluids, blood samples. These are things for a long period of time, so it's there and the patient doesn't continue to have to get stuck, or as they say, they don't have to get a stick. All right. So who wants to continue to get stuck if you have to continue to have treatment for something long term? That is when you start seeing things that are tunneled. If it's peripherally inserted, unlike here, central, it's right there through a large vein in the neck, chest, or groin, they're going to go under. It's peripheral because it's in the arm. Okay. So, or a PIC. You'll see that sometimes in your coding. All right. So this is inserted in a vein that's in the arm, and it'll be tunneled. Okay. And then it will go into a vein. All right. And so that's how that is done. And then you'll see it just taped off. And then again, with this PIC catheter, they're able to just put things in where they need to. Okay. So I'm just giving you that overview because sometimes I know for me, I'd like to have a general idea. You don't have to become providers or anything like that if you're, but you want to understand what it means. So then it makes sense when it's tunneled or it's centrally inserted. Okay. So here are your keywords. Like I said, you've got these keywords, but I like to zero in on the things that will pivot you to the correct code. And indeed, because it's central and it's tunneled and it is a pump. Remember, I showed you the picture. There's a difference between a pump and a port. All right. So, and these particular codes are sometimes age driven. So we're going to start with code 36560, insertion of a tunnel, centrally inserted central venous access device, all of this stuff. But look right there, regardless of what it's saying, this patient is younger than 5. So even if the wording was correct, the patient is too young. So 36560. All right, we're going to take that one away. All right, so our next one, we come here and we've got 36561. Okay, and so this one is for an insertion of a tunnel, centrally inserted venous access. It is subcutaneous. Okay, so I like that age and everything, but hey, still the wording. Okay, so 36561. All right, we're taking that one away as well. So we're going to keep on going. All right, now we've got this insertion of a tunnel centrally inserted central venous catheter without a subcutaneous pump or port. All right, and they are younger than 5. Okay, so this wording here, okay, with the 36558, they're older, but this is without a subcutaneous port or pump, and we have a subcutaneous pump. All right, so that's why we are not going to code for that one. That's without a pump or a port. So this leaves us with 36563, insertion of a tunneled, centrally inserted tunneled venous access with a subcutaneous pump. All right, so that leads us to 36563. And although we didn't need the age for this particular code, it's important to know the age with this code set because several of them are age dependent, okay? But this is the one that we needed, okay? And so this one was a matter of really understanding, is it central? Is it what's going on with it? Is it without a subcutaneous pump? Is it with one? You guys got there. Another way, some of you may have used this chart. Hey, when you can use the chart, all right? And this is for central venous access procedures, and that's what we had. It was tunneled. It can be with a pump, all right? And yes, that's what we needed. And look at there. When we get here, 36563, that would have taken you there as well. Okay, so we're going to keep it moving. If you don't know about this chart or didn't think of it, it is on page 274 of your manual. So that's something to keep in mind if you get one with a central venous access procedure pump. You can use the chart or you can simply look up the code. All right, so I'm going to ask you guys, what is a pacemaker system? And what does it consist of? All right, so I just want you to put your answers in the chat for me. I'm not going to mute myself. This is just one, I like to just kind of throw some little things in there because sometimes just little things will help pivot you to the right answer. You got to know what you're coding for, okay? So what exactly is a pacemaker system? And you guys know I'm asking you this because you know what's coming next, right? You know what scenario is coming next, okay? All right, I see some good answers coming in there. Yeah, I see battery and electrodes, some battery and some leads. Okay, yeah. Okay, I see some folks battery and leads. All right. Yeah, you guys know. Yes, that pacemaker system. It is the pulse generator or the battery and the electrodes, leads, or wires. And be sure that you have this written somewhere in this section of codes so that you understand if you see pulse generator, it's also called a battery. If you see electrodes, it's called leads or wires, okay? Because sometimes just the wording alone, if you're not clear on it, it can trip you up, okay? And it can make it a little more tricky than what it needs to be. But you guys got it. And so now I know you guys are ready for this next scenario. All right, Miss Bennett, shall we? You have the floor.
Let's do it. Do you want to advance the screen? Do you want me to take the screen? Okay.
Y'all had it paused. I'm sorry. I was tinkering.
Right?
Don't mind the lady behind the curtain. Okay, now I'm ready.
All right. A 33210, B 33211, C 33207, and D 33210, 33207 with modifier 51, 33235 with modifier 51. Mrs. Reyes had a temporary ventricular pacemaker electrode placed at the start of a procedure. This temporary system was used as support during the procedure only. How would you report the temporary system? Okay, coders, your 2.5 minutes begin now. Good luck. Okay, that is time.
All right, guys, you heard Miss Bennett. If you hadn't got that answer in there, go ahead and get it in there. All right, we are going to start to unpack this thing. If you didn't quite get there, we are going to get you there. Okay, so I want you guys to take a listen. All right, and we're going to go ahead and do it and make it happen. All right, so I'm liking what I see. Do I have any more takers? All right, before I start to spill the beans, I think I've got everybody. So here we go. All right, so we have our keywords: temporary ventricular pacemaker electrode, and they use support, okay, a temporary support system during the procedure. And your answer is A, okay? A lot of you got there, and if you didn't, we're going to help you get there, all right? So the key word is that this pacemaker was temporary. All right. A temporary ventricular pacemaker. And the support was simply used during this procedure. So we start with code 33210. All right. We have insertion or place replacement of a temporary transvenous single chamber cardiac electrode or pacemaker catheter. All right. So you see it's a separate procedure. If it's not bundled into something else, okay, then you would use this code. And indeed, this is for simply a ventricular pacemaker that lets us know, all right, that it is in one chamber, all right, a single chamber. All right, so we continue and we go down here to 33211. Well, we have temporary, all right, but look at there, dual. And this told us it's simply in the ventricle. So that lets us know it's a single chamber. So 33211, that wouldn't be used. All right, we continue on now. Oh man, before we even look at there, 33206. Okay, now this is your code family, but we see its insertion of new or replacement of a permanent pacemaker. And what did this scenario tell us? Yeah, see, this is pivotal. This is temporary. Okay, it's temporary. So even though this is coding for a ventricular pacemaker, but it's permanent. And that's not what we're looking for. So we're going to take that one off. All right. No, we need something that is temporary. So we continue on and we see this code is here with this code series here. A lot going on with this one. And because we see it here too and it's incorrect, we can go ahead and get rid of that. All right. And we've got the 33235. That's for removal of a permanent dual system. We don't need any of that stuff that's going on, okay? It started out pretty good, but we didn't need all of that. So that one's gone as well. All right, so already we're right back where we started from. That's a good thing. We simply need this insertion of this temporary transvenous single chamber because it's ventricular. All right, that's what we need, okay? And I think a lot of you got there. I had a few of you guys take C, okay? So I could see why that looked good, but there was the sticking point. So if you hadn't boxed this or write it out to the side, just so you know, okay, because there is a difference, and I know you know now, between a permanent and a temporary pacemaker, all right? Okay, so that's it for that one, and we are going to continue on. Yeah, that ventricular, it can throw you off. Remember, a chamber is either the ventricular chamber or the atrial chamber. If it's dual, they're talking about both. Okay, so I hope that little tidbit, all right, will help some of you. All right, so we're going to continue on with our next one. And again, this one will be for 2.5 minutes. And I'm going to have Miss Bennett come and read us out. Thank you, lady.
You're welcome. All right. A 33500, B 33530, C 33496, and D 33496 with modifier 59, and 33530. A month after David's cardiopulmonary bypass, he is experiencing chest pain and presents to his cardiologist. David's doctor agrees that he needs a reoperation to repair the dysfunctional prosthetic valve. How would you code this procedure? Coders, you have 2.5 minutes. Tell us how you would code this procedure. All right, happy coding. Okay, that is time. See lots of great answers. What'd you think
All
about
right,
this one,
coders.
guys?
How do you think? What are they looking? Thank you, Miss Bennett. Hey, I had to go and freshen up my beverage, my V8 energy. I run out. All right, guys. Look, they blew it out of the water, Miss Bennett. Yeah. Hey, I'm loving it, loving it, loving it, loving it. All right, guys, we're gonna go ahead and unpack it, and you guys already see that it is D. All right, way to go. All right, so Miss Carly, you are doing just fine, lady, just fine. So you see your key words. This was a month after David had this cardiopulmonary bypass. Okay, he's experiencing some chest pain, so he's going to need this reoperation to repair this dysfunctional prosthetic valve. So what did this doctor have to do? They're going to have to repair it. So for code 33500, this is for repair of a coronary arterial venous or arterial cardiac. All right. So, we need to repair a prosthetic valve. Okay. All right. So 33500. No, no, no. That's not exactly what we need there. So we're going to take that one away. Okay. We take a look here. First off, this is an add-on code. And while that's reading pretty good, okay, we're going to list this in addition to the primary procedure. And already, because that is an add-on code, okay, it's good, but it can't be first. All right, can't be first. So we're going to give that just kind of a light yes. Although we can't use it like this, we need to go a little further and see what we could use it for. All right. So we have code 33496. This is for repair of a non-structural prosthetic valve dysfunction with cardiopulmonary bypass. All right. So, I like that. And then it's telling us here for reoperation, use 33530 in addition to 33496, and this was a month after they are on cardiopulmonary bypass. All right, yeah, that's some good stuff. And it's even telling you here, even with the add-on code, that we need to use it in conjunction with these codes, and boom, there is our code that we need there, 33496. So this is what we need. We need both because it is for a reoperation. All right. Separate procedure, reoperation there. All right. So 33496. All right. In addition to, yep, the month after, the 33530. All right, and that is your choice. Okay. All right. So I think you guys got that one. You guys, you guys were on point. Okay. And for some of you that got that took B, all right. So I know why you would have taken B, because that was perfect code language. But as soon as you see the add-on, you know, like, hey, I'm gonna have to do something different because that's not quite it. It can't stand by itself. All right. But now I think everybody's clear. I know you are. I'm loving it. All right. If you need to get a screenshot, you may. And then we're going to move on and keep on going. Okay. So here we go. This one is just a little quick one, and I'm not going to mute myself. When a catheter is inserted into the aorta and stays there, what type of catheterization is it? Look at there, Ashmita right out of the gate. I see you guys. All right, I see Geetha in there. LaWanda, what is it called? We're putting that catheter into the aorta and it's staying there. We're not moving it. We're not gonna choose any other thing. All right, I'm seeing some good stuff. Yeah, you guys got it. It is non-selective. I want to be sure if there is anything that really anchors this next coding scenario, it is the ability to understand that when the catheter stays in the aorta, it is non-selective. Okay, and the way I always remember it is if you choose or you select a different a different vein or artery, when you start going into a little different avenue, or if you will, you're selecting a different route. Okay. And so this is just showing you the aorta. All right. As long as you stay in there, you don't start venturing off, it is remaining non-selective. You're going to stay on that main highway, okay? All right, so here is your next scenario, and I'm going to have Miss Bennett. This is my buddy, y'all. I'm tagging her in, lady, and afterwards, you know the drill. 2.5 minutes, and she's gonna keep me on track, y'all. You have the floor.
I do try, coders. I really do. All right. A 36215 75605 with modifier 26. B 36200 75605 with modifier 26. C 36221. And D 36222. In the cath lab, a physician places a catheter in the aortic arch from a right femoral artery puncture to perform an angiography. Fluoroscopic imaging is performed by the physician. What CPT codes are reported? Coders, your 2.5 minutes begin now. Happy coding. That is time, coders. Awesome, awesome.
Thank you, Miss Bennett. All right, guys, if you have not gotten your answer in there, get it in there. I'm going to give you guys maybe about 15 more seconds to slide it on in there. All right, I think I've heard from everybody, and I see some great keywords from some of you. Terrific way to code, guys. All right. Here we go. All right, so we've got for our keywords, all right, this in the cath lab, the physician is placing a catheter in the aortic arch, all right, from the right femoral artery puncture, and they're going to perform an angiography. And we have fluoroscopic imaging that's also performed. And the answer is C. Okay, so everybody was teetering actually between the C and the B. All right, is what I was seeing mostly. Okay, so think you guys are pretty clear on, you have here the descending thoracic because it's in the chest, and then the abdominal aorta, simply because still the same vessel, the major vessel, but it's just coming down to a different area of the body. We're in the abdomen at that point. Okay, there we go. Let me catch you guys up to my screen there. All right. And then we have the aortic arch here, and then we have everything related to the aorta, the aortic arch, the ascending aorta, the ventricle, all that stuff. But we're going to focus on that arch. Okay. So, and you guys already told me, you guys know that if that catheter does not leave the aorta, it's non-selective. But let me let you in on something here. Okay. I showed you where the aortic arch is, but look here, we're talking about, when you look at your code selection for the aortic arch, the cervical cerebral arch, it is an area that is located within the aortic arch. Okay, and so that tells you what? It didn't leave. All right, that tells you it didn't leave. And so for me, this was key. All right, because I start looking up like, well, what where is that? Okay, it is just a little section here. Okay, and it's located here where the aortic arch actually starts to branch off. But you'll see the aortic arch, but also know that the cervical cerebral arch is in this little area. Okay, it's just a little area that they have also named that there. Okay, so aortic arch, and more specifically this area is here, so you know that it is indeed still in the aorta. Okay, all right, so we're going to continue on. All right, so we have for the aortic arch. Okay, you can't hear me, Miss Renata. Can most of you hear me? Can you hear me, Miss Bennett? Okay, all right. So
I can hear you.
okay, so Miss Renata, try muting and then unmuting it to see if my sound comes back for you. Okay. All right, so you guys have these codes here, and like I said, it was a little bit of a split. Most of you got there. If you didn't, we're gonna get you there. So you guys already know selective, selective there for 36215, okay, as well as for 36222. We know that it was non-selective because it stayed in this aortic arch. So we can immediately get rid of those codes. We move on now, and we have 36200, introduction of the catheter into the aorta. All right, and then no, we didn't have the introduction of the catheter. Okay, the catheter was indeed introduced via the right femoral artery. Okay, that was where the puncture was made to start snaking up the catheter. All right, so we don't need that one. All right, and so for non-selective angiography of extracranial carotid and or cerebral vessels and cervical vertebral arch when performed, 36221. Yeah, look at there, it's giving it to us right there. And when we come down here, we see non-selective catheter placement, thoracic arch, cervical cerebral arch. That's where we need, and right there it includes that angiography. There we go, right there. And that is where we need to be. And it's giving us our do not report codes, okay? But we didn't need that in this instance, and that's how we arrived at C. All right. All right, I think you guys are feeling pretty good with this one. So if you need to grab a screenshot, you may, but hey, that's why we always tell you zero in also on those parenthetical guidelines, because although this was no good, look at that right there. This right here told us exactly where we needed to go. So we had some checks and balances in place, didn't we? Okay, all right, we're going to continue on. And yeah, you know, I'm driving this thing home here. Remember that catheter, if it doesn't leave the aorta, okay, it is part of the aorta, this cervical cerebral arch. If it doesn't leave, it's non-selective, okay? And that cervical vertebral arch, it's part of the aorta. All right. You want me to go back to the heart is what you want to see, Renata? The first picture. Let me See if I can grab that you want. All right. Is that what you want, that picture there? And you can go ahead and grab your screenshot. All right, and then I'm going to keep on going. Give me 1 second. I'll get back to our next one. All right. And I know you guys are going to love this one. You're welcome, Miss Renata. You guys are going to love this one because they love the long ones, Miss Bennett. They love them. All right, guys, here we go. You have the floor.
Okie dokie. All right. A33405, 33533 with modifier 51, 33517. B, 33405, 33533 with modifier 51, 33517, and 35600. C, 33405, 33533 with modifier 51, 33510, 35500. And D, 33411, 33533 with modifier 51, 33517, and 35600. Preoperative diagnosis: aortic valve stenosis with coronary artery disease associated with congestive heart failure. Postoperative diagnosis: same. Anesthesia, general endotracheal incision, median sternotomy. Description of procedure: the patient was brought to the operating room and placed in supine position. After the patient was prepared, median sternotomy incision was carried out and conduits were taken from the left arm as well as the right thigh. She was cannulated after the aorta and atrium were exposed and after full heparinization. She went on cardiopulmonary bypass and the aortic cross clamp was applied. Cardioplegia was delivered through the coronary sinuses in a retrograde manner. The patient was cooled to 32 degrees. Iced slush was applied to the heart. The aortic valve was then exposed through the aortic root by transverse incision. The valve leaflets were removed, and the 23 St. Jude mechanical valve was secured into position by circumferential pleated sutures. At this point, aortotomy was closed. Attention was turned to the coronary arteries. The first obtuse marginal artery was a very large target, and the vein graft to this target indeed produced an excellent amount of flow. Proximal anastomosis was then carried out to the foot of the aorta. The radial artery was anastomosed to the left anterior descending artery target in an end-to-end, end-to-side manner. The proximal anastomosis was then carried out to the root of the aorta. The patient came off cardiopulmonary bypass after aortic cross clamp was released. She was adequately warmed. Protamine was given without adverse effect. Sternal closure was then done using wires. The subcutaneous layers were closed using vicryl suture. The skin was approximated using staples. What are the CPT codes? Coders, good luck. Your 2.5 minutes begin now. Okay, coders, that is time.
Coders, I know you guys are still working on it. We're going to give you guys maybe give them just one more minute on this one, Miss Bennett. I know they're working through it. I know you guys are breaking it down, so we're going to give you one more minute so you guys can have time to just think it through, okay? And then we're going to start coding.
Okay, that's your minute.
Thank you, Miss Bennett. All right, how we looking there in that chat? There we go. I'm seeing more answers in there now. I see you guys working. I'm loving it, loving it, loving it. All right, so we're gonna start unpacking this thing. I want to answer everybody here. So you guys know we see you. Miss Bennett and I see you guys working so hard, all right? But we're going to have to go ahead and start doing some explaining. There are several concepts in this particular scenario. So although I know it's not always fun to do these, it's really just a combination of several smaller codes, or really smaller scenarios, if you will, just all together, okay? And so we're going to just unpack it. And when you see it, you guys are going to be clear, all right? I assure you. All right, so the answer is B. All right. And I'm gonna talk about how we got there, okay? So our preoperative diagnosis is this aortic valve stenosis with coronary artery disease associated with congestive heart failure. The postoperative diagnosis is the same. Okay, so it's important to know that, because you guys know that if you have a preoperative diagnosis and a postoperative diagnosis, you're always going to go with the postoperative diagnosis. Okay, and so this is the same. They're telling us about the incision. They've made a median sternotomy. Okay, so with this median sternotomy, we know that they're making an incision. Okay, they're going to have to. They've got a lot of things to do here. And so for the description, it's telling us what's happened, that they brought the patient into the operating room. They're supine. Naturally, they are. Supine means they're on their back. They're facing up. Of course they are. We've got to get to the sternum so that we can get to the heart and start making some bypasses, if you will, through this heart. We've got to open some things up. Okay, so they're going to put this patient on cardiopulmonary bypass. They're clamping off the aorta. They are cooling the heart, okay, if you will. They're going to slow the heart down and cool it off so that they can start doing some work. So here we have the coronary sinuses. They have gone through them in a retrograde manner. We've got the aortic valve. We've got a transverse incision. Again, we know all of these things are open. We have the valve leaflets that were removed, and a St. Jude mechanical valve was secured. Okay, so at this point, we've already looked at what's happening. We've got several things out of this first little paragraph. They're on cardiopulmonary bypass. Of course they are. They're working on this heart. They've got to cool it off and slow it down. Okay, and we know they're making an incision, and we are doing something with some valve leaflets. In fact, we're removing them and putting some mechanical valves in place. All right, we move on down here. And so here we go. We've answered that question. Aortic valve replacement, they're going to put in a prosthetic one, this St. Jude, with a bypass. How? It's an open procedure because we have a sternotomy incision. We move on down here, the next paragraph. Now we're going to turn our attention to these arteries. This person, obviously, they are having some trouble with blood flow. So we've got to open some things up. We're going to have to bypass some things, okay? So they're going to turn their attention to the coronary arteries. We've got this first obtuse marginal artery, okay? Very large target. We're going to have a vein graft to this one, okay? And obviously, when they say very large target, obviously this thing looks pretty meaty, so we can get a lot of blood flow through that thing. So we're gonna fix that thing up, okay? So yeah, when they look at this one and they've got this vein graft, it's gonna produce, yeah, excellent amount of flow of blood. That's what we're aiming for. Then the proximal anastomosis was carried out to the foot of the aorta. Then they took a look at the radial artery, okay? It was anastomosed to the left anterior descending artery. Then we had this proximal anastomosis to the aorta, okay? So the main thing you want to start paying attention to when you see all this is, what are we doing as far as grafting, okay? What are we grabbing? Well, we've got a vein graft and we have a radial artery, okay? All right, so that's what's going on with this second paragraph. So here, the Cabbage, coronary artery bypass. Remember I said we've got to get around some things that have been blocked, and we're going to do that by creating some grafts, okay? So we've got one artery, the radial artery, and then we have this one vein graft. All right, now where is it harvested from? Okay, it's harvested from the radial. All right, so right there. So we're going to carry this stuff over. First thing we're going to do is work on this valve. All right, this St. Jude valve is what they're going to put in. All right, they are on cardiopulmonary bypass. So for code 33405, we obviously know that that's it because it's in all of these. All right, and so we know that this one is probably the outlier. Okay, so we're going to take a look though. Prosthetic valve replacement, prosthetic valve replacement. All right, this one is 33411, replacement of an aortic valve. Okay, no, and that's non-coronary sinus. That's not what happened. We need this prosthetic valve replacement. So that's correct there. All right, so no go to that one. Now we move on to this one, okay? All of them have it. All of them share this one. So let's take a look at it, okay? So this one is from this code family here. We have 33533, all right? So this is coronary artery bypass. That's what's happening, and they're using an arterial graft, all right? So here we have our FTRs here, all right? We've got one arterial graft. All right, and it's coming from a radial artery. All right, so we've got one artery there, one artery there. All right, now, and we've got a vein graft. Okay, and so that's our add-on, and it's telling us there to use that in conjunction with, okay, here. All right, so we're going to need that because that falls in our line there. All right, yeah, 33533. And remember, when you are doing a combination, we got to code that artery first. So that's why that artery is there, but we've got to account for the vein. This one right here is only coding for the vein. We need a combo code. So that's why that one's incorrect. All right, so now this and this are the same. Now, here is the next sticking point. So now if you were teetering between A and B, and that's what I saw, a lot of that, okay? I saw some took C, but now you understand why this one wouldn't be your choice, because when you have a combination code, you're going to have to choose from that group of codes, the combo codes that lists the artery first, followed by the vein selection, okay? So this is our combo code. But if you take the harvest from a radial artery, it's not bundled. So you have to be specific. You're going to have to code specifically for that harvest from the radial artery. And there we have it. Harvest from the upper extremity artery. Specifically, it's the radial artery. It's not bundled in the procedure. as though some of them would be, but specifically, you guys should have it in your FTRs. The ones that are not bundled, you have to break it out and code for it. All right. And so that's letting us know we've got to do it. This is missing the harvest code. Okay. So don't get tripped up that yes, the harvest is bundled, but it depends on the code. Okay. And so for this one, if you have this radial artery, you're going to have to code for it. And that's why you need the 35600. So if you got here, and a lot of you did, remember certain harvest codes, you're going to have to code for it separately. Okay. All right. So is everybody good? Like I said, some of you got there to B, and then I saw a few people on A and a few people on C, and I could see why. Okay. All right. I'm seeing some yes and some all good. Very good. And this one was nice because it actually broke it out so you could kind of, see it. So I would suggest that if you see something like this, and I saw Miss Bennett give someone some a great suggestion to just simply remember to break it down sentence by sentence and just set up your inventory. So you could break it down like that in your head so that you can do one thing at a time. Okay. All right. Okay. Geetha, I understand. You'll have to let it simmer a little bit. Did you get the screenshots of it? Because a lot of times with cardio, it takes some time. Did you get the screenshots for everything so you can go back? I always tell you guys grab that first screen and then just go back and then look and then just let it simmer a bit. And even go back and listen to some of the all of your instruction from class and stuff like that. It takes a minute with cardio. I trust me, I do understand. All right. All right. We're going to have Miss Bennett come on. You guys take a breath. You're doing just fine. If you just got a little bit closer to understanding something, that's a good thing. Okay. Just continue to work with it. It will come. All right, Miss Bennett, it is all yours, lady.
Copy that. All right, coders, you are doing well. Be patient with yourselves, and this too shall it shall come. All right. A 33464 33406 with modifier 51. B 33426 33405 with modifier 51. C 33430 33405 with modifier 51. And D 33468 33426 with modifier 51. Patient undergoes a mitral valve repair with a ring insertion and an aortic valve replacement on cardiopulmonary bypass. Which are the correct CPT codes? Coders, you have 2.5 minutes to tell us which are the correct CPT codes. All right, good luck. Okie doke. It is time.
Thank you, Miss Bennett. Hey, I see a lot of folks doing some happy dances in that chat. Yes, I do. Yes, I do. All right. So we're going to go ahead and unpack it. Look, nobody invited me to the dance party, Miss Bennett. Y'all are over there happy dancing. I'm glad to see it. All right, so we're just going to quickly move through this one. We have this mitral valve replacement of this mitral valve repair, with a ring insertion and an aortic valve replacement. And hey, they're on cardiopulmonary bypass as well. Okay. All right. So the answer was B. You guys got there. And hey, I'm loving to see it. And you guys know I can't resist a little bit of midterm. You guys already knew that valvuloplasty means a valve repair. So valvuloplasty, tricuspid valve. Well, no, we are talking about what? We are talking about what? The tricuspid valve. All right. And we need the mitral. Okay. So we know that 33463. No, wrong valve. Okay. Yeah, ring insertion and all that stuff, but wrong place. All right. Tricuspid valve there. All right. So here we need what? Replacement mitral valve. Okay. We've got the right valve, but this one here is recording for a replacement. We need a repair. All right. All righty. So we need a repair of what's going on, but we're replacing the aortic valve, not the mitral. All right, so this one is a matter of just reading carefully, and you guys did that, okay? It's making sure that you're understanding what's happening with each valve, okay? We got a mitral repair and an aortic replacement. So we have 33468, tricuspid valve repositioning, implication for Epstein anomaly. Boy, oh boy, was there a lot going on. All right, so no, for repositioning, hey, this is what we got left, all right, just by process of elimination, okay? We have the valvuloplasty, all right, which is the repair. That's why you guys know I'm always a stickler with that med term. So yeah, that's the repair. Mitral valve, that's what we need. Cardiopulmonary bypass, we need it with a prosthetic ring. Okay, yeah, there we go. Repaired it with a ring insertion. 33426, that's spot on. And then what are we doing with that aorta? We're doing a replacement of the aortic valve. Yeah, that's exactly what happened there. And again, with cardiopulmonary bypass. And hey, we are right there with our 51 modifier as well. All right, because we did have multiple procedures. Super job, guys. So, hey, you guys didn't need much help. This was a matter of keeping track of what was being repaired, okay, and what was being replaced. All right, we're going to keep it moving. All right, so with your chart, I don't know if it's on 218 for you guys, because this one, I don't, well, anyway, this is about your chart for batteries and all that stuff, okay? So when would you be able to use that chart, okay? It's used for what type of pacemaker replacement, okay? What type of pacemaker replacement could you use your chart? And you hear me flipping over here because I should have verified the page number. So now I'm over here flipping in my book. So yeah, I see a lot of good answers coming in there, Miss Bennett. I think these coders, they know their books. All right, I'm loving it, loving it, loving it, guys. All right, so yeah, transvenous. That's right. If it is a transvenous insertion of this pacemaker, then we can use that handy dandy chart if you are so inclined. Okay. All right. So we are going to move on to our next scenario, and I am going to have Miss Bennett come. And hey, for any of you who are worried about the spelling of anything you put in that chat, don't you worry. We know exactly what you are saying, okay? Because hey, I have my own as well with the typos. Never you worry. I want you guys focused and honed in on coding, all right? Come on, Miss Bennett.
Plus, it's hard to misspell A, B, C, or D, right? Am I right? Okay. All right, so A, 33244, 33241 with modifier 51, 33240, B, 33262, C, 33236, 33202 with modifier 51, 33206 with modifier 51, and D, 33241, 33240 with modifier 51, 33233 with modifier 51. A patient required a battery change for a single chamber pacing cardioverter defibrillator system. The battery was taken out in a subcutaneous fashion and a new battery placed. The cardioverter defibrillator was then reattached to the electrodes, which were intact and tested, and the skin pocket was then closed. How should these services be reported? Coders, your 2.5 minutes begin now. Happy coding. Okay, that is time.
Thank you, Miss Bennett. All right, guys, I'm seeing some good answers coming in that chat. If you hadn't gotten your answer in there, go ahead and slide it on in. And then we're going to go ahead and unpack it, okay? If you just missed it, no worries. We got you. All right, that's what you're here for. We're going to get you clear, okay? So, do I have any more takers on this one? I'm going to give you guys one little small little minute, and then we're going to go ahead and do what we need to do. All right, I'm still seeing just a few answers come. All right, I'm going to give you guys 10 seconds. All right, let's go ahead and see this thing, okay? So I had a little bit of a split on this one, and no worries, all right? Like I always tell you, that is why you're making this investment of your time. You guys are doing a tremendous job, okay? Just a little tweak is what we're going to do, okay? So they're coming in because they need a battery change for a single chamber cardio defibrillator system. The battery's been taken out in a subcutaneous fashion, and a new battery was placed, and they're going to reattach those electrodes, and that skin pocket was then closed. Okay. All right. Now, I hope you have those FTRs on your correct pages, because it's going to help to pivot you and keep you on track. It's like your map. All right. So what's taking place? We have a replacement. Okay. It's taken out and a new one was placed. Okay. That's what's happening with this single chamber. Remember, when you see cardio defibrillator system, remember, you guys know when I give you those little small little questions before we start getting into the scenarios, it's for a reason. I want you to apply that particular thing that you know when you see that they are going to change out this battery for a single chamber pacing system. Okay, so we've got the battery, all right, and then the codes and the electrodes are going to need to be reattached. Okay, so we've got the battery, we got the defibrillator, a single chamber, subcutaneous, and the answer is B. Okay, and the other thing is we're going to get over here and see. Remember that pulse generator is also called that battery. So this one is for removal of a permanent epicardial pacemaker. All right, and electrodes by thoracotomy. So we already know we're changing the battery. All right, this is for the removal of the actual pacemaker and the electrodes. Okay, we're just changing out the battery. And also, this is talking about a thoracotomy. We know that this took place subcutaneous. Okay, so this is for the defibrillator system. The battery was taken out, but it was subcutaneous. All right, so 33236, we're going to take that one away. All right, so out of there. All right, we continue on. 33240, this is for insertion of an implantable defibrillator pulse generator. All right, so this is for the insertion of a generator or a battery, but we're doing a battery change. Okay, this is only for the insertion of that battery. All right, so this one here is for removal of an implantable defibrillator pulse generator only. All right, but this is telling us all of our do nots. All right, so here we go. 33241. All right, so we know we wouldn't use that one. Okay, so I'm just telling you why these wouldn't go. All right, so because these are incorrect, all of that's gotta go. All right, so we have 33241. This was for the removal of the implantable defibrillator pulse generator only. We're just removing it. We need a battery change. Okay, all right, and once I tell you all the time, all right, for this one, if the first code is incorrect, you really don't have to continue on. It doesn't have to be, if this lead code, remember, if the lead code is incorrect, all of it is off the board. Okay, so don't keep going to prove that it's even more wrong. All right, so this one's incorrect, gone. This first lead code incorrect, it's gone. So it's leaving us here already with 33262. Okay, so it's telling us all of these do not codes, but once you know that this code, if a code doesn't apply, don't even keep going. All right, but here you're going to use, it's telling you we don't report this one in conjunction with these, but if we have the removal and replacement of an implantable defibrillator pulse generator, we're going to use these codes here, 33263, and these that follow, okay, when appropriate. All right, when we have a replacement. So we come over here and we take a look at it, and indeed, removal of implantable defibrillator pulse generator with replacement of implantable defibrillator pulse generator. Single system. Okay, that is our code right there. Battery change. Okay, single chamber. That's the code right there. And we have our do not. words for this code as well. Okay. And in this case, none of those applied. And so this is your code. This one here, when you're digging through, it is a matter of keeping straight, sometimes seeing all the other stuff that you have the battery and then everything had to be reattached, the electrodes. Think about it. The electrodes would have to be reattached because you got to take the battery out. So that's just describing what they're doing. They're unattaching the leads, but they're not replacing that. They've got to unhook the leads in order to take the battery out. Take the battery out, put a new battery in. That is all they did. And we have to be specific in that it is a single chamber and it is a defibrillator system. And that's what we're keying in on. So you guys know, whenever I'm showing you a scenario and I'm showing you the key words, because this helps you to get a full picture of what you need to focus on. But these words here that I like to box, those things will pivot you into your code selection. Okay. All right. Okay, so there we go. And you don't have to use the chart. It's there, if that's your thing. For me, I like to dig into the codes, and sometimes I might use the chart just as a checks and balances, if you will, but I prefer to dig into the codes myself. But the chart is there. And hey, if that works, that's a good thing. Yeah, and hey, I understand, Geetha. So yeah, and sometimes that's right, Lisa. For some people, it's like me. I'm like, I don't know. I need to just dig into the chart. Okay. So yeah, and don't overthink it. I see some of you are like, man, I was overthinking that thing and I second guessed myself. No worries. With all of this, it was simply a battery change and understanding what system it was. And when you see about these leads, don't let that throw you. Those electrodes or the leads, they've got to unattach them or they can't get the battery out. Okay. So no worries. Just grab your screenshot if you need it, and we're going to continue on. And this was how you get it with the chart here. All right. So removal pulse generator, replacement of that pulse generator, only the single lead. And again, it was a defibrillator. And so, of course, then we get down here to 33262. All right. And so you could have gotten it that way if the chart works for you, again, as long as it's what it is, transvenous. Okay. All right. So we're going to keep it moving. All right. I'm going to have my partner here come and read us out. And you guys are doing fantastic. Just take a breath. I know cardio is just one code at a time, but you're doing just fine. All right, lady, you've got the floor.
Okie doke. All right. A, 36415. B, 36592. C, 36591. And D, 37799. A 35-year-old female patient with a venous catheter requires a blood sample for hematology testing. The sample is collected via her PICC catheter. How would you report this procedure? Coders, your 2.5 minutes begin now. Good luck. Okie dokie, artichoke, that's time.
All right, coders, I'm seeing some good stuff. I'm seeing some good stuff, Miss Bennett. Look at these coders. All right, guys. Hey, if you haven't gotten it in there, go ahead and get that answer in there, okay? And if you just missed it, that's okay. All right, we're gonna get you there. We're gonna give you that nudge that you need, okay? We got you. Either way, we got you, okay? All right, so here we go. Now we have this 35-year-old female. They've had a venous catheter that requires a blood sample for hematology testing. So how are we gonna collect this? They're 35 years old, a venous catheter that's requiring a blood sample for hematology testing, and the sample is collected via her PIC catheter. All right, the answer is B. Remember, yeah, that's right, Carla. That aha moment. That's right. Yeah, remember, that's why I was telling you guys, about the different types of catheters, okay? You have the port, you got a PIC, and what they're used for, okay? So we're going to take a look here. Venous catheter blood samples, what we're looking for. Okay, so hematology PIC catheter. Okay, that's why we need the blood sample for hematology testing. So for code 36415, they're collecting some venous blood, but it's by venipuncture. No, this person has the PIC catheter. Remember, I was telling you guys that is the purpose when people have a PIC catheter or a tunneled catheter or a port. It is so that they don't continue to have venipuncture. You don't have to continue to get that needle out. They've got that PIC there in this case, so they can collect the blood. So that one's out. All right. So what about 36592? Collection of blood specimen using established central or peripheral catheter, venous, not otherwise specified. I like that. That's some good stuff. Yeah, collecting the blood specimen. Yeah, it is an established central or peripheral catheter. Okay, so that's good because what does PIC stand for? Okay, all right, peripheral intravenous catheter. Okay, central catheter. All right, so we're going to hold that one. All right, so we go on to, and right there, for blood collection from an established arterial catheter, then you would use this. Okay, so we actually have 37799 unlisted. Well, it is listed. Okay, you'd only use that if they didn't have it. And here they're giving you one of the examples that you could use it for, but that doesn't apply in this case. Okay, it is not an unlisted procedure. We have some code language to address what's happening in that scenario. And then for code 36591, collection of blood specimen from a completely implantable venous access device. Okay, this is a venous catheter, okay, that we already have. All right, so there we go. We have this PIC catheter. All right, we're not worried about an implantable venous access device. Okay, so 36592, this is the more appropriate code. All right, it reads exactly with what we need. Okay, so I'm seeing some aha moments. All right, so that is terrific. All right, this one was kind of like a little bit of alphabet soup. All right, and it was just a matter of just narrowing that thing down and getting to the proper code. And you guys, you got it now. You have got it now. All right, so if you need a screenshot, you can grab it. And if you're clear, that's even better. And we're going to continue on. Yeah, we've got some more to do. All right, Miss Bennett, the floor is yours, lady.
Yay! All right. A, 36252, 36251. B, 36245 with modifier LT, 36245 with modifier 59 and LT, 36245 with modifier 59 and RT, 75774 with modifier 26. C, 36245, 36245 with modifier 59, 36245 with modifier 59, 36252 with modifier 26, and D, 36252. In the cath lab, from a right femoral artery access, the following procedures are performed. Catheter placed in the left renal, accessory renal superior to the left renal and one main right renal artery. Radiologic supervision and imaging is performed in all locations. What CPT codes are reported? Coders, your 2.5 minutes. Begin right now. Okay, that is time.
Thank you so much, Miss Bennett. All right, I see you coders. Y'all are working in that chat. I'm loving what I'm seeing. All right. So for those of you who didn't quite get there, no worries. Like I always tell you, we got you. That is why you are here. You are in the right place. Okay. So we're gonna help you guys kind of sort through this thing, all right? Because I want you guys to be clear. And even if you don't make cardiology one of your favorites on the exam, I want you to be more than proficient so that you do well on there. All right. So I see some folks getting some good answers in there. You just needed a little nudge. I see those answers coming in. All righty. Here we go. We're going to talk about how we got to D. All right. So this person was indeed in the cath lab, all right? And so what was performed? They had the catheter placed in the left renal, accessory renal superior to the left renal, and one main right renal artery. All right, we did have radiologic supervision and imaging at all of these locations. So we're going to unpack this thing, all right? So it's a whole lot of things that kind of give you pause a little bit, but we're just going to do what we always do, just take a look at it one step at a time. So we have 36251. All right, so this is for selective catheter placement, first order. All right, you know, when you start talking about first order, remember you have those charts and stuff towards the back of your book. I always tell you, make real good friends with this CPT manual. There's a lot of good stuff in there, but you got to know that it's there and how to get to it. Okay, so this is for selective catheter placement, main renal artery. All right, main right renal artery. Okay, any accessory renal artery or arteries. Look at there, accessory renal. left superior to the left renal, the accessory renal superior to the left renal, and we've got this right main renal artery as well. And what? They've got an angiography going on, radiologic supervision and interpretation. They got a whole lot of stuff going on that we are loving. 5 key words, okay? But what's the problem with this one? That one's unilateral. All right, that one's unilateral. All right, so yeah, look at there. We've got the left renal and the right renal. Okay, so unilateral, that wouldn't do. We right there. That's what we need. That 36525. Yeah, bilateral. Okay, but we've got to do our due diligence. Let's see, what is this 36245? Because really, this is all we're looking at. Or these two. This is the code family, and that's why I always stress to you guys. Notice the common code language for the family. Everything before this semicolon is good stuff. When it went south was right here. We didn't need unilateral, so that's no good, but that common code language is good. So when the common code language is good, we got to take a look at these dependents, and this dependent right here, that's good. This 36245 selective catheter placement,
Pardon me.
arterial.
Pardon the interruption, Miss Tamika. I don't see your screen moving.
Oh, man. Look, I'm just talking and looking at my screen. I know better. I know better. Y'all know. Look here, I was trying to do good because we got company with Miss Bennett. Okay, and I did it anyway. Give me 1 second. Let me double back real quick so y'all can see the on clicks. Okay, I'm sorry. I'm just talking and having a good old time here. All right, so there we go. Y'all know how I have to freeze my screen. I'm always tinkering behind the scenes. All right, so here are your keywords. We've got that catheter placed in the left renal. We've got the accessory renal that's superior to the left renal, and one main right renal artery. We've got that radiologic supervision and imaging in all of these locations. So let's go over here and unpack it. We see here, you know, I'm always telling you guys, let's get this thing to 50-50 if we can. We've got 36252 and 36245. These are the codes that we have to consider for this lead-off code. So for 36251, it is selective. All right. We've got the main renal artery. All right. Any accessory renal artery or arteries. What do we have there? Accessory renal. All right. And we have this accessory renal superior to the left renal and one main right renal artery. That's reading good. Okay, we've got angiography, okay, and radiologic supervision and interpretation. 5 key words there. We've got a lot of things going on that happen. But what is the issue? The sticking point here is that it's unilateral. Remember, I always tell you, take note, everything before this semicolon is common code language. So this is good stuff. The issue is this code language that's specific for that code is no good, but we're going to keep this here because look at code 36252. It is for bilateral. That's unilateral, so we can already get rid of that, okay? We have the left and the right. It's bilateral. All right, so that's why we need the 36252, okay? So we're getting rid of that one because that's the unilateral code. We don't need that, okay? All right, because it's in the code language. That right there, we don't need one and then another. Just bilateral, okay? You guys knew not to go with that one. What about 36245? It is selective, but it's for the arterial system, okay? And this is talking, we don't have an angio going on, okay? Because that's here. The angiography, that's here in that code language. And we didn't need all of these things that's being described. So we don't need the 36245. It's talking about selective catheter placement into the arterial system. But this 36251 is very specific in what's going on with this catheter placement. Okay, we've got the main renal artery. We've got those accessory arteries. We've got the angiography. We've got the radiologic supervision and interpretation. And you guys know whenever you can have a code that contains all of the things needed, it's bundled in the code language, if you will, then you're not going to start coding all this stuff. This is what we need, and it's indeed bilateral, and that's why all we need is 36252. You don't want to start coding individual things when it's part of a combo code that has everything you need. Okay, that would be unbundling, if you will. All right, how we doing with that one? All right, yeah, just calm yourself, just calm yourself and do what you need to do. Okay, just when you're reading it, that's why the keywords, okay? You're seeing many keywords there. Keep that in mind, because we're only selecting really between 36252. I'm doing this because that's the code, the common code language. That's the parent. All right, but we need this dependent here, okay? But remember that common code language. I know I'm always drilling that home, but if the common code language is good, take a look at what's falling beneath it, because most likely that could possibly be a go, and in this case it was. Okay, and this one, yeah, we didn't need that. We didn't have any angio going on, and this is really general. Yeah, selective catheter placement, but look at all these keywords and what it addressed. Okay, so that keyword concept is key. All right, you guys know I could keep on coding and keep on coding, and I wish I could, but I have to get out of the way of my buddy Miss Michonne. And you guys know we don't want to get booted out of here, but we did get through 10 of them, and that's always my goal, is to at least get through 10, possibly a dozen if we can, but at least a 10, because that's how many you're going to have with each section. And remember, with cardio, it's going to be combined with respiratory. Okay, so you might have a split of 5 and 5. Okay, so how we feeling, guys? You know, I always love it when you guys come and hang out and participate. I'm gonna have Miss Bennett come to the floor. Grab this screenshot while she comes to the floor. Come on.
Thank you so much, coders. You guys are awesome. As I noticed when I came in here, I was like, uh-oh, these are the high achievers. And I see it. I saw a lot of aha moments, but the reason for the aha moments are priceless, right? You guys will probably never make these mistakes again. And thank you for having me. And we will see you soon, okay?
Thank you, Miss Bennett. Hey, coders, it is always my pleasure, okay? And you guys know why we want your feedback. You know why it's important. It is always our goal to deliver quality classes to you, deserving coders here at AMCI. It helps your instructor. It helps me to help you. It helps Miss Bennett, too. All right? No feedback means no good. We want to know what's on your mind, coders. You guys have been outstanding. I appreciate your active participation. And like I always say, thank you for sharing your precious time on a Saturday morning with myself and Miss Bennett. I certainly hope that we have made it worth your time and your effort, and that you have come away with just a little bit more knowledge to help you feel a bit better about your cardiovascular coding. We wish you the best. All right. So have a great day. All right. And we will see you on next Saturday. I'll be here. I'll be here. And I certainly hope you will be too. What? Somebody's having a birthday? Oh man, you enjoy it, Miss Carla. Enjoy it. My daughter's birthday is today too. Okay, so today the cupcakes don't count. All right, I'm gonna eat one on your behalf too. Okay, all right, guys. We'll see you next time. As always, it has been my pleasure. We'll see you again soon.